Amyloidosis is a very rare disease caused by amyloid buildup on the organs, tissues, or nerves. Amyloids are an abnormal protein that are manufactured in the bone marrow. The abnormality is caused in the cell by a protein misfolding. Normal proteins are biodegradable, recyclable, and soluble. The abnormal amyloid protein is insoluble. In this image, globs of misfolded proteins called amyloid plaques, or blobs, are found outside neurons, the triangular structures. Amyloid plaques are associated with many chronic and debilitating diseases. The effects on the body systems. Amyloidosis can affect the heart, interfering with the function of the cardiac system. Buildup of amyloids on the nervous system can cause muscle weakness and paralysis. When there is a buildup of plaque on the organs may stop functioning, sometimes resulting in death. There are 4 types of amyloidosis that have been identified. Primary AL light chain, which is not associated with other diseases and normally affects the heart, lungs, skin, tongue, nerves, and intestines. Secondary AA, serum A, SAA, which is usually associated with an underlying chronic disease, affects the kidneys, spleen, liver, and intestines. Hereditary, ATTR and non-ATTR, which runs in families, can affect the nervous and digestive systems. Wild other, formerly called SAA, senile systemic amyloidosis. Wild other occurs most commonly in men over 80. Wild-type TTR can be present in carpal tunnel syndrome, which can be a first symptom of amyloidosis. Amyloids are also being identified with a relationship to Alzheimer's disease. Plaques form when pieces called beta amyloid clump together. The most damaging form of beta amyloid may be in groups of a few pieces rather than the plaques themselves. These groups are called tangles. Symptoms include abnormal heart rhythm, numbness or tingling of hands or feet, severe fatigue and weakness, shortness of breath, enlarged tongue, macroglossia, swelling of ankles and legs, or skin changes. Diagnosis: urinalysis to look for albumin and amyloid proteins in the urine, blood tests to check for amyloid proteins and hyperlipidemia, blood tests for kidney function, measure the waste products in the blood that healthy kidneys normally filter out. Amyloid proteins in blood may indicate amyloidosis. Imaging tests to look for buildup on organs and/or tissues. Treatments depend on the type of amyloidosis. Chemotherapy to stop the growth of abnormal protein cells, stem cell therapy, where stem cells are collected from your own blood and stored while high-dose chemotherapy is administered. The stem cells are then returned to the body. Liver transplant, when the type of disease is hereditary, because the liver is where this type of protein is produced. Medications can only control the signs and symptoms, such as diuretics for fluid retention, pain relievers, or anti-inflammatories. In summary, amyloidosis is extremely rare, affecting less than 4,000 people in the U.S. each year. There is no cure, but treatment can help manage symptoms and prevent further production of amyloid proteins.